Hi class, welcome to Module 9. Coming towards the end of the course, and this particular module again is a almost 2-week module. It's going to cross over Thanksgiving. So keep that in mind as you're thinking about when you're going to contribute to the discussion boards and what's coming into place. So I'm not closing the discussion boards until after Thanksgiving. But you still need to post before Thanksgiving your initial post, as always. We're talking about older adults and the family lives of older adults. And think about this. As we started this course, we asked how we define family. And in the past, there were people who did not define family as anything without children. What we've really experienced is a rapidly changing environment where older adults are families that are brought together, and they are there without children because we do not have children at later ages or long amounts of children. We don't have 10 and 12 children, we have 1 and 2. So those are in place. So the size of the older adult population is larger than ever in the United States and all first world countries. We don't have the largest percentage. In fact, the oldest adults are in Japan. They live longer there in Japan and in Hong Kong than they do in the United States. And there have been some drop even in life expectancy in the United States in the last couple of years. But it's much longer than in the past. And older adults are staying healthier and they're staying in the workforce as well. Now, there are good pieces and bad pieces to that, as we'll see as we go into talking about this, but there's significant advantages of having this older adult population still working. Current older adults are more economically secure, but that too is changing. The richest older adult population are those that were born in the 1920s and 30s. They've been able to save at higher rates and save more. They're more likely to have had retirement built into their employment and pension systems, where older adults retiring today, especially those we see coming through as the baby boomers. And remember, the baby boomers start in 1946. So that's the current population coming through. These numbers are more likely to be divorced or single. These are also the population that will increase in cohabitation, which we talked about so much earlier. And they're very much this older adult part of grandparenting. Now, this chapter really shouldn't just talk about older adults. It's really talking about those middle years as well. Middle years being parents become grandparents in their 40s and 50s. And they're not really considered old. Remember, aging is a social construct. Basically, we put it together, we make that up, and we have to determine what really is an older person. So, what resources older families had in their past, reflect on what's happening today. So let me get that changed as far as the writing, but hopefully you'll break some of the stereotypes and beliefs as you explore aging, as you look at this social construct. With that said, let's pop over to the PowerPoint. So I've left you thinking about what's a social construct of age. Well, it's pretty ambiguous as how we measure what is age. Is it when you belong to the AARP at 50? Is it when you retire at 66, 67, depending on what you are? Is it when you qualify for that? So defining old age is pretty difficult. When we ask people to define it, some will say gray hair, and I'm in real trouble because I had gray hair in my 30s. No longer at least sexually active, and therefore, believe me, 80 and 90-year-olds don't fit this category because they are definitely still sexually active. So you can see the definitions that come into place of people saying they are old. But defining old age is, again, ambiguous, ambiguous. And it's problematic, isn't it? And when researchers have been looking at this topic, it's been very interesting, and they have divided it into three categories: the young old, the old, and the oldest old. Now, the young old are 65 to 74, and think about that. As we've looked at the family, working family, we know that this is a population still in the workforce. Because of the changing work environment. If you've taken other sociology classes, you well know that today the demands of jobs have changed significantly, so that it isn't the physical jobs that they're often in, but also finances drive this, and so economic downturns come into play. And even in the old here at 75 to 84, these this category will still have people working in irregular places. My aunt Millie died at 90, and she had been working well into her 80s. She didn't like staying home. She wasn't a person who had a lot of crafts and activities, and even though she had worked both industrial jobs and secretarial jobs, she chose to work at a store where she was in the video area and checking out videos, and that way she got to meet people and get to know people. And it supported her income, supported her in a little bit and added to it. I don't know as if that was her biggest concern as much as it was the interaction with other people. So you see, these categories really don't always reflect where we're going, but we have to drop them into categories as we do with so many other things to evaluate what's going on. Now, the macro population pyramids are given to you by your book, and you can see how in the past the population here was a pyramid. That the oldest population became very small, and the younger population was down here as a level of support. This demographic change that has occurred, and you can see this in 110 years, looks like things are much more equal. Now remember, this is based on birth rates that come into place, and perhaps my picture being over here will affect that. I don't know as you start exploring this, but look how even this is as we look at birth rates aren't at these large levels. And here's the kind of that baby boomer type piece coming through. Now remember, the baby boomers were born from 1946 to 1965. So that's a very large period of time, and basically they were the boom in population. This is when we get more of the view of traditional families. We see moms staying home raising kids, that type of picture coming into place. And these are, like I often tell my classes, it's like a snake that swallows the egg to eat. Its stomach of the snake is not until it's halfway down the snake, and that's what the baby boomers are like. And they're this bump out that kind of occurs in this area. And then we can see that as they start to face death, then we'll get that smaller picture, but even that will be larger in our future. So this demographic continues to affect society. And so we have this change then that comes into place facing such things as living arrangements. Who are these people with? What's going on? Well, living arrangements in the United States today, we see, are still very much that couples are together, that the majority of men, and you can see this in 1960 to today, still are living with their spouse. And we can see that from what we consider older adults, from 65 and older. In 1960, 35% of women were living with their spouse. Today, 46% are living with their spouse. So the highest place for older adults to be is with their spouse. But they do face the issues of losing their life partner, their spouse, and so we have this higher percentage of living alone. And we also have the effects of divorce that comes into place. As this population ages, especially these baby boomers are more likely to have been part of divorce in that process. And we can see the percentage here that in 1960, about 21% of men lived with others, and that could have been with other friends, but oftentimes with family members. And we can see that in the past for women, it was significantly higher. And look how it's dropped pretty significantly. This is a population that remains independent. And we don't always think of them as that independent level of care. So, more interesting things about this particular population, if you look at the demographics, that this living arrangement is significantly different, but poverty rates have definitely declined for the 65 and older since 1959. Now, there are multiple things come into place here, and we're going to see that those economic pictures make a difference. So in 1935, we established Social Security that comes into place to support the older adult population, especially those that have not saved well. It gives that background into place. Well, by the time the 50s, and we're going into the 60s, we're seeing a population that has been working in a fairly stable environment with Social Security available to them, and many of them having especially retirement plans into place, and they have pension plans from their employers, and so a strong work history. They have big savings. Now in the 1950s and 60s, savings were paid at a high level. So a passbook savings account, which we don't even have today, but a savings account, as we think of today, that earns less than 1%. And that period of time was earning anywhere from 5 to 8%. And there was a lot of availability for saving, and that is still reflected within the process. So the poverty rates of older adults have changed over time, and this is the richest older adult population we've ever had, but expect that to decline to occur based on the demographics. Now, there's a significant difference based on race and ethnicity. And so as we look at poverty rates, the highest poverty rates are Hispanics among older adults, and seconded by African Americans. Now, what's interesting in this chart, we don't include Native Americans. And if we look at Native Americans, they would be significantly higher even as we break them out as a category. So significant issues come into place that we have to consider related to income, that during the current recession that was occurring, that we're considering ending in the early 2010s, 11s, many older people stayed in the workforce longer and are continuing to be in the workforce today. So we see this changing dynamic of this population. In fact, it is recommended, and you'll see that in your videos, it's recommended today that older adults stay in the workforce until at least 70 for significant reasons that come into place. So the social construct of retirement is changing, isn't it? But we constructed this idea of retirement. Now, I mentioned before, Social Security was established in 1935. That was based on numbers that were actually developed from a social science study that comes out of Germany. And it seemed to be at that particular time the right number for the United States. At that period of time, less than 10% of people lived to be 65 and older. Today, we see a significant difference. The average life expectancy today is significantly higher, and it varies depending on the year, but about 73 for men and about 78 for women. And if you've lived to the age of 65, the likelihood is you will live 12 to 13 years more. So not once you've reached 65, you'll probably live to be 78, 79, even older in that process. So it varies. And men and women's retirement are different. Your book addresses this some. It's important, and you'll pick some of that up in the video as well. That oftentimes men retire at later ages than women, but we see that women have married older men and they want to retire together. There's some real issues in this particular family that we don't have time to go into, that you'll hit on in the sociology of aging, of issues that couples face in retirement because they're couples longer today. So, total retirement incomes claim on the economy. You can see the significant difference that is going on here of what Social Security will be paying out over this time period of your life. And we talk about the drain of this older adult population on the younger adult population. And yet we see that this increase is not as great as we think in place. But the cost of caring for the elderly, the Social Security programs, we can see the involvement of the cost here of private insurance plans, of Medicaid, and the big one being healthcare, the healthcare costs that come into place. So other things to think about here. Romantic relationships of older adults, how do they meet? How do they marry? And in my in-class course, they have to plan a marriage for older adult couple, where you were in this class allowed to plan your own wedding for yourself because you're not working in groups. And my class group that got this asked, can we do a renewal of vows? No. The answer was no, because they have romantic relationships and they are involved in finding new relationships. So we see very complex marital and family histories become involved with older adults that are dating because of their past relationships, of their children's effect. Marriage is the most common relationship status for the population as a whole, but we're seeing a great increase in cohabitation in this older adult population for multiple reasons that come into place, like protecting their finances. This population is an active population. And we know that within those marital statuses, they try to remain active and they have romance in place. There is significant differences. So romantic relationships of older adults, again, more complex as we look at that, but that increase of cohabitation, increase in alternate marriages. We have more acceptance of gay and lesbian in our population today. So we have more older adults that are gay and lesbian relationships. And so that's significantly changed as we look at this arrangement that goes on. So the percentage of unmarried older adults that are cohabitating, we see the largest percentage in the 50s, smaller in the 60s, and in the 70s, smaller. Expect that to continue to grow. But look at the difference here as we look at age 55 and older. The divorce are separated in that cohabitation is so much higher than it was before. Now, older adults contribute to families in many ways. They have their own family of husband and wife, or whoever they're cohabitating with within the family, but they fill the role of grandparenting. Now remember, grandparenting comes into place can be at a very young age, depending on when your children have children. So grandparenting can start in the 30s, but more likely in the 40s and 50s. And there are multiple things that grandparents do. And it depends on their relationship with the parent and how they can have that in place. So grandparenting roles over the last centuries, grandparents have become a distinct role. Grandparents are healthier and better educated. They're more likely to recognize the importance importance of emotional involvement, and grandparents and their grandchildren can more easily travel long distances or communicate by computer and phone. FaceTiming with my grandchildren allows me at least to see them when they're 7-hour drive away. I'm able to keep up on their contacts through Facebook and Twitter. It changes that relationship. And so we see the family research that looks at grandparenting, and we see these particular roles that are put into place as a compassionate grandparent. And grandchildren, they have fun together, they enjoy recreational activities on a regular basis, and they are important to one another's lives. Grandparents can do this from a distance, whether they're close, geographically or not. Remote grandparents are emotionally distanced and may visit infrequently, and they only have minimal involvement. And then there's the involved grandparent who are highly involved, and they take care of their grandchildren on a regular basis, sometimes living together. Grandparents play extremely important roles in the backup of families, and grandparents become caregivers for their grandchildren. So we see why children are the least likely to live with grandparents. We see that intergenerational family is more likely to occur in Blacks, in Asians, and in Hispanic. So big changes within that. Grandparents as caregivers are a safety network for younger generations. They are providers of care on a regular basis as far as child care. About 12 to 14% of grandparents provide regular child care for their grandchildren or great-grandchildren. They help the family with the high cost of child care. They are a huge support in that, and they are very important to that. They are also the fallback place for divorced parents to come home to. We have that, again, refilling of the empty nest. And in divorce situations, they provide the role of the absent parent. They will give the strong male figure, the grandfather will be, or if the mother is missing, the grandmother will become that female figure. And so that there is significant roles that they perform in this process. Of those 14% that are providing regular child care for their grandchildren, about 8 to 9% of them are actually doing raising their grandchildren and doing it on their own without their parent present. Pretty significant issues when we look at what comes into place. Now think about that in the process of this aging family. If they're raising their grandchildren, they are spending money in a very different way than saving for their own retirement. And we see the double bind that comes into place here. It's interesting, and again, our text is really good at pointing out these changes where grandparents were in aging populations are highly considered burdens. We see that the percentage is really different than we're thinking about, that it's really this population providing support for the family in more cases than the family, that middle family time period, providing the support for the older adult. So we see the percentage of children living with grandparents, and we can see that with no parents present, all children, about 20% we see here, and the variation that comes into place. So some real interesting pictures as we start to explore this. Now there's an intergenerational exchange that we've been talking about all the way through this, and that the exchange flows down the generation from parent to adult children. But there is that return of adult children helping parents. Now we call this in some cases the sandwich generation. Now the sandwich generation actually refers to those that are caring for their children and caring for older adults. But it's an important population to consider because of the double burden of work. For adult children helping their parents, Most help are for unmarried older people because caregivers are the #1 source of caring. In fact, caregivers, spousal caregivers will caregive for more than an average of 10 years, where children as caregivers, their average length of caregiving is 4. And it's very substantial. Again, we don't have enough time to go into all of those things. I'm already running long on this, but it's a 2-week, week and a half class as we're thinking about it. Those that need for care is highest among those 85 and above, those oldest old in the population. So let's look at why. Here's the health. And so we see this as far as the level of disability that comes into place. If we're looking at 65 and older, about 54.5% report one disability, one physical disability that comes into place. And we can see the statistics given to us. The common chronic conditions of older adults are listed here for you. And then we can see the disabilities play the heaviest toll on those that are in the very old category. So the 85 plus, 70%, more than 70% have one disability, and 57% have, 70% have one disability, and 57% have more than one disability. And then we see the need for assistance due to their disability is about 34% of those 80 plus. So living arrangements for the older adults, likely to be living with a spouse, less than 5% are in nursing home. And we've got those statistics and some information here from the government statistics from 2011. So, some quick things. The stress of caregiving can be strong. It can be very stressful. It can be stressful on the spouse as a caregiver. It can be stressful on the child as the caregiver. Think of the stress that the older adult has in caring as well. So we see these emotional hardships come into place. So in general, older adults have very complex intergenerational relationships that follow the more complex family. Divorce introduces big areas of differences, and we know that the relationship to a father after divorce is not as strong as to a mother, and part of that's based on that. And so we see the individual things that come into place as you explore this relationship, this diverse, multi-generational relationship brought about by so many other things that have happened in their lives. With that said, let's flip back to what you're doing for this module. So you have a number of videos to watch this week. A quick little 2-minute one on living apart, living together. Some of the new trends that are coming into place, new ideas as far as older adults and living arrangements. So think about cohabitation, and then when you watch this particular movie, think about how this type of relation keeps people healthy. To talk about this at a deeper level, I'm using the PBS series about aging, and so just 3 quick ones that are about 20 minutes long. So aging in the workplace and why aging matters, addresses who's in the workplace and why people are staying in the workplace and how it is beneficial to both the older adult and the current population. I once had a student say, these people need to retire, they're taking our jobs. And I want you to think about that as you're viewing this video. Is that the case? The next is on the financial issues and why they're important, and finally on the health. Then you'll move on to your discussion board, an article on the aging family or the older adult family, And I hope you can focus on some of the positives as you look at the articles and not just the negatives. And finally, your weekly quiz. With that, I hope you have a great week and a wonderful Thanksgiving. I look forward to your discussion boards as always. And we're coming to the end of the class. So one more major module, which is a wrap-up, as well as information on social supports out in the community, and social policy related to the family. And don't forget that your paper is due on November 27th. You should be ready to have it all in the Dropbox, and I hopefully will have those graded within a week. Have a great day.